Hi, my name is Angela Alvarez, and I decided to do my oral presentation on phobia. So what is phobia? It is an excessive and irrational fear reaction, and one has a phobia, maybe they experience like a deep sense of fear, or sometimes they can get anxiety attacks just from seeing the source of fear. And a phobia can be towards a place or a situation. So for example, a place can be amusement park, and a situation could be a social interaction with someone, or a object can be, for example, in an amusement park, some people are afraid of roller coasters. Some phobias can be extremely disabling, and they can really affect a person depending on what the phobia is. Some common phobias are social phobia, which is a worry about social interaction and situations. Agoraphobia is a fear of heights. Claustrophobia is a fear of enclosed spaces, so like small confined spaces, like such as elevators. Aviophobia is fear of flying, so like flying in an airplane, helicopter. Dentophobia is fear of dentists or dental procedures, so many people are afraid of having a tooth pulled out or just going to the dentist in general. Hemophobia is a fear of blood, so that's usually typically when someone has a cut and they see blood, and sometimes some people faint or they have an anxiety attack from just seeing the blood. Nyctophobia is the last on here. It's usually the fear of night or the dark. Someone is in a dark space that can make them freak out or panic. So next we have causes of phobia. Phobia can be caused sometimes by genetics. So sometimes if a family member has some kind of anxiety disorder, or sometimes another person in the family can develop that just from a family member having it. Another way is a distressing event such as nearly drowning that can cause to develop a fear of the ocean or water or swimming. People with ongoing medical conditions like schizophrenia are more likely to develop phobias. Traumatic brain injuries, like if someone got in a car wreck and they've got a really bad brain injury, they can develop a phobia as well. Substance abuse and depression can also make someone develop a phobia. Treatments usually for phobia, one is cognitive behavioral therapy. So basically what that is that they expose the person to their source of fear, and they basically try to make it as calm as possible, as gentle as possible, in order for the person to get over their fear. And another way is medication through either antidepressants or anti-anxiety medication. The next is phobia trends. So phobia that has the most increase is social phobia, according to the US NCS. Based on their data, they concluded that social phobia has increased significantly over the last 4 decades. Two primary classes of people with social phobia are usually those who have fear of speaking or other social evaluative skills. Increase is mainly seen in white, educated, married persons. They're the ones who they have seen social phobia the most in. Okay, so the summary for this project is basically, so phobias can severely affect someone's life. For example, social phobia has really been shown to affect people the most. So for example, if a situation where someone has social phobia and they decide to work as a host at a restaurant, because of their mindset, they're gonna think, oh, well, I might humiliate myself, or I can't talk to this person because I'm afraid that they might judge me. They have that kind of mindset, so they might do their job poorly, or they just might freak out, have an anxiety attack in the middle of their job, and that can affect the company's business. It can affect the person's job. The person can get fired. So this situation can apply to any phobias according to the phobia. Without phobias being treated with things like cognitive behavioral therapy or with medication, sometimes the phobias can intensify, and usually if it's a phobia that can really affect someone's life, they will have a very, very difficult time being able to go on with their daily lives. So from this project, I have concluded that many phobias need to be taken care of in medication or cognitive behavioral therapy, and that's it. Thank you for watching my presentation.